Hello, everyone, and thank you for joining us this afternoon. I want to provide you today with the latest on COVID-19 virus, previously known as coronavirus, and what Arizona is doing to protect public health, prepare for the potential of additional cases, and to minimize the risk to Arizonans. I'm grateful to have with me Health Services Director Dr. Cara Christ, Wendy Smith-Reeve, our Director of Emergency Management, Dana Kennedy of the AARP, and Dave Oipel of the Arizona Healthcare Association. Here at the state level, we've cleared the deck. COVID-19 is my top priority, my team's top priority, and Dr. Cara Christ's top priority. Dr. Christ and her team of health professionals have been working 24/7 to ensure we're communicating the facts to everyone in our state, the education community, the business community, government officials, and the media. This morning I participated on a video conference call with Vice President Mike Pence, the Secretary of Health and Human Services, Alex Azar, top federal health officials, and the nation's governors. Vice President Pence stressed the importance of being calm and steady in our efforts to protect public health, and that's the approach that we've been taking in Arizona. We will continue to follow the facts, providing all information that we have in a transparent and timely manner. When I know something, you'll know what we know. And we'll be using every tool in our toolbox to reduce community spread and protect public health. Arizona is approved by the Centers for Disease Control to conduct in-house testing right here in this lab. That has allowed us to quickly diagnose and provide treatment. We know that for 80% of people who contract COVID-19, it will be mild. We also know that seniors, especially those with underlying health conditions, are most at risk for serious complications. I want to say that one more time. We also know that seniors, especially those with underlying health conditions, are most at risk for serious complications. To address these factors, we have been communicating with the health professionals and facilities caring for Arizona's elderly population. Moments ago, I met with leaders of these facilities across our state to ensure they are aware of the proper precautions and getting all the support that they need. Department of Health Services will continue to stay in close contact with long-term care professionals and nursing home providers to ensure that the latest information is being shared and all precautions are in place. As part of this effort, DHS will be sending out surveyors to confirm enhanced infection control protocols are in place for vulnerable populations at nursing care facilities and hospitals. I'm going to hand it over now to Dr. Cara Christ to provide additional updates. Director?
Thank you, Governor Ducey, for the introduction and your leadership to ensure the health and safety of our communities. I'm grateful for the partnerships that we have in working with DEMA Deputy Director Wendy Smith-Reeve and community stakeholders, including Dana Kennedy with AARP and Dave Oipel of the Arizona Healthcare Association. My team has been working nonstop in response to COVID-19 and ensure we keep our communities and families safe while having as minimal of an impact on Arizonans' daily lives as possible. Here's the latest information about the spread of COVID-19 in Arizona. To date, we've had 6 cases. 2 of the cases have been confirmed by the Centers for Disease Control and Prevention, and the other 4 are presumptive positive cases tested right here at the Arizona State Public Health Lab. A presumptive positive case has been tested at the lab, but is still pending confirmation from CDC. However, we still take public health action on those results. There are 2 cases in Maricopa County, 3 cases in Pinal County, and 1 case in Pima County that was just recently announced. The 6th case will be updated on our website with our daily data update at 9 a.m. tomorrow. As we announced Sunday, one of the 6 Arizona cases is a member of the American Leadership Academy Ironwood K-12 campus, and state and local public health are actively investigating to identify any close contacts that may have been exposed. Identified individuals will be monitored for fever and respiratory symptoms. The school has proactively implemented public health recommendations, including school notifications and cleaning and disinfection of school grounds. This individual did not have severe illness and is not currently symptomatic. Because the individual was not on campus while ill, public health believes the risk to others outside of close contacts for them getting COVID-19 from this person is low. Public health will provide specific patient information in the event there is a risk to the public. We prioritize a balance of patient protection and ensuring the public is provided information when necessary to protect the public health. There has now been community spread of COVID-19 in Arizona, and we are expecting more cases. While it's impossible to predict how many cases we will have, the number of cases could be similar to a flu season in Arizona. We want to ensure that the people at highest risk for COVID-19 are taking every precaution to stay safe from the disease. Those that are at highest risk are older adults and people with serious medical conditions like heart disease, diabetes, or lung disease. I know this can be very concerning for family members, friends, and loved ones in this high-risk community. My children's grandparents and great-grandparents live in the Valley, and I want to assure everyone that we are doing everything we can to bring awareness on what steps you can take to mitigate the spread. People at high risk should be prepared if an outbreak happens in their community, and we encourage them to have supplies on hand, such as extra prescription medications, over-the-counter medications, and supplies like tissues and other household items and groceries. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas like your doorknobs, light switches, toilets, faucets, and phones. Stay away from crowds if possible, and have a plan that if you get sick to call your healthcare provider and identify who else can care for you if your caregiver becomes ill. Tragically, there have been 19 deaths in Washington state, and many of the deaths have been in long-term care facilities. There are several steps long-term care facilities can take to help stop the spread of this disease. Our team reviewed these recommendations in an informational session for long-term care facilities last week and met with a number of long-term care facility administrators earlier today. I would like to provide you all with some brief remarks about our recommendations. The first is to limit visitors. We understand long-term care and assisted living facilities are people's homes. Part of our recommendations for infection prevention include balancing good physical health while maintaining mental and emotional health of all residents, which can often be impacted by visitation. Therefore, we recommend that facilities screen all visitors for illness before visiting, post signs at the facility entrance instructing visitors not to visit if they have symptoms of respiratory infection. Consider limiting visits from children, similar to what a lot of facilities do during influenza season, and try to accommodate visitors by phone or video conferencing before allowing them to physically visit. Our second recommendation is about infection control activities within a facility. We recommend facilities prevent the introduction of respiratory germs by educating all staff and residents on the prevention of respiratory viruses, which includes COVID-19. This education includes basic hand washing, respiratory hygiene, and implementation of standard, contact, and droplet precautions. Staff and residents should be up to date on vaccinations, including their seasonal influenza vaccination. And facilities should ensure sick policies allow employees to stay home if they have symptoms of a respiratory infection. Facilities should also assess resident symptoms of respiratory infection upon admission to the facility and implement appropriate infection prevention practices for incoming symptomatic residents. For those residents who are sick with respiratory illness, we recommend that workers take precaution when entering a resident's room. So facilities should post signs on the door or wall outside of the room that clearly describe the type of precautions needed and required in order to protect that resident and themselves. Make personal protective equipment, including face masks, eye protection, gowns, and gloves immediately available outside of the resident room. And position a trash can near the exit inside any resident room to make it easy for staff to discard personal protective equipment and other materials. Residents experiencing respiratory illness should have a designated dining area apart from a dining area for the well residents. And if sick individuals must leave their room, we ask that facilities make sure they wear a face mask. Finally, we recommend that facilities identify dedicated employees to care for sick residents. These employees should only care for sick residents and not also for well residents. What can the public do to help protect this very vulnerable group? To stop the spread of COVID-19 and ensure our loved ones in long-term care and assisted living facilities are safe, there are also things we are going to request. Take precautions similar to those that we recommend for the prevention of other diseases. The best way to prevent the spread of respiratory illness is to wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue and then immediately throw the tissue in the trash. Clean and disinfect frequently touched surfaces and objects. And if you need to see a healthcare provider, consider telemedicine as an option. I urge everyone to find reputable sources for information about COVID-19 and please don't spread inaccurate information. The public health departments are great resources and will continue to provide factual, up-to-date information. You can always find the most up-to-date information on our website at azhealth.gov/COVID, and you can contact your local public health department, such as the Maricopa County Department of Public Health or Pima County Health Department. We have a link on our website that will link you to your local county health department. CDC.gov is another resource for up-to-date information. Again, I want to assure everyone that the public health system in Arizona is well prepared to respond to the spread of COVID-19 in Arizona. We will continue to provide the public with the most up-to-date information and advice on how to keep yourself and your loved ones safe. We will now have time for a few questions.
Let's start with Bob.
You just said that it's in the community now and you expect it to be similar to a normal flu season. Can you put a number on what a normal flu season is?
So this current year, we are at about 28,000 flu cases, but normally we're somewhere in the high thousands to tens of thousands of cases. So we expect a large numbers of this. I'm sorry.
And those are diagnosed cases as opposed to people who don't go to the doctor, right? So it's a percentage of what you really see.
So that's the tip of the iceberg. You are exactly right of what we see. So these are only individuals who have had the flu and have gone to see a healthcare provider and been tested for that. So we know that there's a lot more people who don't seek healthcare with respiratory illness symptoms and are still in the community.
Let's start here and then go back to 12.
Governor, these questions for you. Dr. Grish just mentioned to avoid crowds if possible. Have you been in touch with any of the organizations that hold a lot of events here? I know we're in the middle of spring training. We just saw the Tucson Festival of Books was just canceled. There was a case reported of somebody that was at Sky Harbor just a few weeks ago. Have you been in contact with anyone, and are you worried about the impact potentially on our economy with this?
Well, I want to begin by saying my first concern is for public health. This is part of the reason that I'm briefed both morning and evening on this issue with continuous updates, and it's our top priority. We're communicating with the business community, of course, state government, and the education community on the situation in Arizona as it is right now. We're going to prepare for all possibilities. We'll, of course, hope for the best here, but We're talking about the fundamentals of what people can do to avoid the community spread of COVID-19. We're in a situation right now in Arizona where Dr. Christ was able to share with you the metrics and situation we have with the individuals that have tested positive. And as events change on the ground, our communication will change.
So do you think that then they should be proactive rather than reactive and not go to games or events or other things that are happening in the Valley?
I think what you heard in terms of the elderly individuals or individuals that are older than the age of 60 with underlying health conditions are the ones that are most vulnerable at this time. And we want people to understand that. We want to emphasize that point. We think that that's something where we should be taking the most care and concern. Of course, there have been some events that have made a decision to stand down or to cancel. But at this time, that would be up to those events and the leaders of those events.
Michael, with the number of kits, with the number of cases expected to grow, do we have enough kits to actually test and make sure that we're able to, especially if we get to the high thousands, know if all these people are diagnosed with COVID-19?
So the lab capacity is increasing in Arizona. So the state public health lab, even for influenza, does not do every influenza test, but a lot of those get ordered by healthcare providers and are provided by diagnostic laboratories. We have enough to prioritize the public health concerned, the ones that public health is following up. LabCorp and Quest just recently brought on capacity for healthcare providers to order it just like you normally would when you go to your healthcare provider's office. And we're working with healthcare providers to identify what their needs are in order to be able to provide those tests so that we can increase the capacity.
But how many could we handle right here? Because this is the only facility in the state that can actually test for COVID-19 in the state, correct?
So we can test on site here. What we can do is we have the capacity to do 450 tests per day. That would be, but we also have test kits. So we are supposed to get more test kits today or tomorrow, but we currently have enough capacity to reach the demand for right now.
Before you had 300, are you still around that 300 number or less? Is there some of that?
Yeah, I think we're somewhere around 300 to 600, and I think we're getting more test kits today or tomorrow.
We'll go to staffing and then we'll come up here.
What's the condition of the woman from Pinal County who's hospitalized?
I have not been given a recent update. I still believe she is in the hospital, but we can double check and follow back up with you, Stephanie.
What is the current risk level for Arizonans? A week ago or a few days ago, it was still low. What would you say at this time?
I would say that the risk to Arizonans is heightened. You still do need to come into contact with somebody with COVID-19. I think now that it's in the community, that's much more of a possibility than when it was just with those individuals that had traveled from Wuhan or from China. We would recommend taking those general respiratory illness precautions and act like everyone has it.
Matt?
One for the governor and one for Dr. Chris. Governor, do you think this is overblown?
The federal government on, I think, January 31st declared a national health emergency from Health and Human Services. So, no, we've seen the deaths in Washington State. We've seen what's happened in China, in Italy, in South Korea, and Iran. I think we want to take every possible precaution to prevent community spread, avoid and deal with this, and make sure our most vulnerable populations are aware of the situation and can do everything that they can to avoid it. And we are prepared to care for them in time of need.
Maria, did you have a question?
Can I just follow up with Dr. Chris?
Yeah, then we'll go to Maria.
Dr. Chris, you talked about parents and grandparents here all. If they had a trip within the United States, would you tell them not to get on a plane right now?
So my recommendation to anybody who is elderly with an underlying medical condition would be to very seriously consider travel. If it's a short period of time and it was something that they absolutely had to go to, there are precautions you can take. If it's a longer trip and if it was just for travel or enjoyment, I would recommend that my mother or my grandmother not take that trip at this time.
Maria?
Dr. Chris, there's been a lot of confusion about with these test for those who have to get tested, whether they'll have to pay for it, and if so, how much. Can you talk about that a little bit, both now and going forward?
Absolutely. So in regards to the payment for testing, so those that currently are getting tested right now with public health, our Arizona State Public Health Laboratory provides that testing for free. But that does require a public health approval to get tested. When LabCorp and Quest are performing tests, I don't know what the charge is. Likely insurance companies, we know that Medicaid and Medicare will cover the costs of those tests. For uninsured, I'm not sure. That may be something that we need to reach out through public health.
So here.
And what are the criteria to get tested? Because we have some viewers talking to Channel 3 and 5 and saying they're not able to get tested and they'd like to be. And they have their healthcare workers as well, people who are working in the hospital, they're also at risk. So can you talk about those issues? So
we are at the state lab prioritizing those that are at very high risk for COVID-19. So if they have a history of travel or contact with a known case, they are prioritized. If they are hospitalized and don't have another diagnosis, like their influenza panel and their viral respiratory panel is negative and there's no other, then we will prioritize them as well. We are also looking at expanding that, but that's a discussion between the healthcare provider and local public health to prioritize.
Are you concerned about the Democratic debates coming up here in Arizona too, all the people that are going to be coming into town for that?
I would say if you are elderly and have an underlying medical condition, I would talk to your healthcare physician if you have concerns. At this point, we are not recommending canceling mass gatherings unless they are serving a high-risk population.
Howie?
We won't even talk about where Bernie fits into elderly and conditions, but leaving that aside, let me come back to your earlier numbers that I think you mentioned to Bob. We're talking about potentially tens of thousands of cases, and that is, as you say, the tip of the iceberg. This seems to be a whole different tenor than few here and few there. I mean, should Arizonans be worried?
I would say at this time, Arizonans should be concerned about the possibility of getting COVID-19. We know that it is in our community, just like influenza. It's spread just the same way. And so if you've got underlying medical conditions or you are elderly and that puts you at risk and you have concerns, we would recommend talking to your healthcare provider. And then for anybody who has a loved one who falls into that risk category, to make sure that they are very careful to take those precautions around that loved one.
Just a quick follow-up, because it came up in terms of the question about travel.
Yeah.
We've seen what happens on cruise lines. They've seen, the CDC has basically said they're floating viral labs. What about airplanes, with the same recirculated air? What is your belief about people taking a flight, let's say 5-hour flight from here to New York on an airplane? Are they more at risk because they're in that cylinder?
I would say because of the close quarters, and if you're next to somebody who is sick, you do have the possibility of getting exposed. I think there's a big difference between getting on an airplane versus a cruise line, where you are also sharing dining facilities, touching utensils. A lot of the same facilities are being used for days on end. So I think that that's what increases the risk between an airline flight, where you may be on it 6 to 8 hours versus days confined with the same group of people.
So just to make clear, people should not take cruises?
At this time, I would recommend, especially if you're elderly or have an underlying medical condition, check the Department of State's recommendations, because I think they do have recommendations now about cruise lines.
Harvey, do you have a question?
Yeah. We all know, at least we've heard at this time, that droplets can be spread through droplets. Can you give us some clarity about being able to catch the disease in terms of just casual contact, just sitting across from somebody?
Or a press conference.
So our recommendation is to avoid people who are sick, and you want to stay about 2 meters away from that individual. But if you are trying to social distance, it's maintaining that distance between another person, because it is droplet spread. So if I were to sneeze right now and had it, or cough, Governor Ducey would be in that potential zone, but the rest of you would not be, because you're far enough away. Now, if I sneezed into my hand and touched the doorknob, there could be a risk that one of you walking out could get it from that contact.
But you're not sneezing or doing anything, and I'm just about a foot away from you. Can you catch it that way? You know that.
If they are sick, if you know that they're sick, we would still recommend keeping that distance, because sometimes people get very excited when they talk. There's sneezing and coughing, and so and a lot of times, sometimes people don't have warning with that. So I would just make sure that you are maintaining social distance, because it's the close proximity that increases your risk, and the amount of time that you spend in that close proximity that increases your risk.
One more down here.
Thank you. Governor, you mentioned that you're preparing for all possibilities, and I appreciate the information about long-term care and assisted living centers. When you say we're talking about planning for all possibilities, can you describe what might lead you to declare a state of emergency, or what other possibilities are you planning for? I mean, we all know there's a shortage, for example, of healthcare workers across the state, and so what sorts of moderate to worst case scenarios are you sort of planning for? What does that look like?
So as governor, there are certain authorities that we can put into place to deal with the spread of the virus as it escalates. That's why we want to be very clear in terms of what we're communicating. We want to strike the balance between complete transparency and timely information, and not being alarmist, while taking this very seriously as the top priority. I mentioned that Health and Human Services did declare that national health emergency. There are different declarations that we can escalate at the appropriate time that allows us to make necessary decisions to access state resources and, if necessary, federal resources. We're not there at this time, but that's why I'm briefed every morning with continuous updates, so that we can do the best of our ability, stay ahead of the situation, know what the facts are, and make the appropriate, responsible decisions with a sense of urgency.
This morning you mentioned you hope maybe Congress could help out a little bit when it comes to the governors, and you said you mentioned that this afternoon.
Well, we had a conference call, video conference call with Vice President Pence and other leading federal health officials. All 50 governors were on the line. The governors share information. Of course, what's happening in Washington State or a state like Rhode Island is different than what's happening in Arizona. So we're able to learn from some of the situations, some of the things that possibly they could have done earlier or are doing now. And when I say this idea of hoping for the best but preparing for the worst, is to have those thoughts, ideas, preparations, and resources in place so that at the appropriate time we can act if that is the way that the situation happens.
Governor, you say we're not there yet. What would it take for us to get there?
Well, we just gave you the facts on that we have 6 cases in the state of Arizona. As the situation unfolds, we'll follow the facts.
Would it take somebody dying in our state to declare a state of emergency?
No, I don't think that. I'm not going to do any hypotheticals right now. We will deal with the facts on an hourly basis.
We've got about 1 more minute, so let's do one more in front here, and then we really have to get going.
In regards to the local economy, Governor, some warehouses, Costco, Walmart have reported shortages of water, paper towel, cleaning products, and on the other hand, Asian-owned businesses have reported losses of up to 50%. If this continues, what action plan or what do we have?
Well, first, let me say my first concern is around public health. The economy is resilient, and our focus is going to be on public health and safety and stopping the spread of COVID-19. There has been a bit of alarmist communication that's been out there, and there's been a run on some of these items. I would ask people to buy what they need. To be prepared. I'm confident that these items that are in the consumer market will be replenished, and people should have the appropriate items in stock and at home. And the other economic issues. Just before I came here, I think you probably saw the press conference in Washington, D.C. with discussion and an announcement on federal assistance economically that we'll hear about tomorrow.
Governor, just really quickly on that, half the point, you do have Asian-owned businesses, restaurants that are suffering. I don't know which one of you is in position to answer that. Is there something you can tell the people, please tell these cameras here, about whether people should avoid or not avoid Asian restaurants and such?
I'll defer to the health expert, but I think that the information has been pretty consistent about who is in harm's way, who is most vulnerable here, and it's the elderly with chronic underlying conditions over the age of 60. And why don't you answer the remainder of that question?
Sure. There is no public health recommendation to avoid Chinese or Asian restaurants at this time. If you enjoy going to one and you're comfortable eating there on a normal basis, keep enjoying the food.
Thank you, everyone. That's about the time that we have. If you have additional questions, you know how to reach out to Chris.
Provide the egg food for everyone?
Oh, no.
Before you go, I know you just cut off, but can you tell us how you went from 6 cases to a statement that we have community spread that you expect to go into the tens of thousands?
So Friday night, we announced that we had our first individual that did not have linkage to a known case with travel. So that's where our community spread is. We know that once it is in the community, we will see increased cases.
Okay, thank you.
Thank you, everyone.